Okay, in your presentation, you said that your patient had no previous experience with dentures. How does an experienced person differ from an inexperienced denture? He doesn't have none. He had no dentures before.
First of all, his attitude toward the clinics, first of all, and how to deal with the complete denture itself.
Okay, attitude. This is good because you took notice about the psychology of the patient. So that if he does not know what will happen, what does that mean on your term?
No, I have the responsibility to make a good denture, so that he.
Other than that, for the attitude, he's not expecting. He doesn't know what are the procedures.
I have to explain.
Explain. So a lot of explanation goes here. We're going to do this today. We're going to do this tomorrow. Next time we'll do this. So a lot of explanations. What else?
What else? Expectations. I can say.
Expectations. Will be if the attitude. Will be he confident that you're going to do a good denture, or will be he hesitant and doubtful?
If had
No experience.
no experience, لا بالعكس expectations بتكون higher.
Higher. In some patients,
Yeah.
and you will have two types of patients. Patients that come to you that you're going to solve all of the problems, patients that are hesitant and have all of the back stories from the relatives ready to confront you with. So you have these two types of patients in terms of attitude. There are the positives, and they will be very cooperative and you'll enjoy having them.
Negatives.
And the negatives that have, they are doubtful and they are expecting problems to happen. Okay? So you have to deal with those two psychologies. They know the expectations, they don't have expectations, so they don't know what are the steps, so you need a lot of explanation. What else?
What else?
What about the soft tissue profile in these patients?
كمان دكتور soft tissue profile.
Okay. You will either have a recent extraction
True.
and all of what's consequences of recent extractions. So it depends on how long they had the recent extraction. So you will have to respect the tissue while healing. If it was a recent healing, you will work as if it's an immediate denture. If it was a long term, they have been long term using their ridges for occlusion, for biting on teeth. They're using their ridges. You will have a lot of pseudo class 3s. You'll have a lot of eccentric movements. You have to train them until the RCP. Okay? What else? These are for terms of soft tissue and ridges. Bone. What about the bone?
ممكن يكون إذا كان في عنا recent extraction ممكن يكون sharp. إذا كان في عنا long time ممكن يكون resorb.
Okay. What about, let's say, their adaptation? Okay, I'm trying to brainstorm myself to get these things. But when I'm going to do the video, I'm going to revisit this issue and have a written comment added to the video with all of those possible differences. What about the adaptation for the new denture?
He had no experience, so he have to take a lot of time experience.
Longer time for adaptation.
Sure.
Speech, tongue movements. You will expect to have overextensions causing ulcers and discomforts. You have to always predict the problems. So tell them today I'm going to let you go home with no pain and no discomfort. But when you're going to use the denture, you will most probably suffer, and this is normal. Most patients have them, and you have to come back as recalls to solve these problems. Okay? So these are all parts of the adaptation period. The speech adaptation, the cleaning. You have to give very clear instruction. The cleaning, not dropping the dentures, how to store them at night, not to wear them at night, and all of these are emphasized when patient has no experience with dentures. Okay?